Assalamualaikum warahmatullahi wabarakatuh. Hi everyone, I hope you are well and hope you stay healthy. I'm Zenitha Viola Kusuma Yudiasmara. I'm from the first semester of Diploma 3 in Blood Bank Technology, Health Polytechnic of the Ministry of Health Semarang. And I'm looking forward to talking with you today about blood transfusion. Please pay attention. What is a blood transfusion? Blood transfusion is the process of transferring blood or blood products into one's circulation intravenously. Transfusions are used for various medical conditions to replace lost components of the blood. Early transfusion used whole blood, but modern medical practice commonly use only components of the blood, such as red blood cell, white blood cell, plasma, clotting factor, and platelet. Why might we need a blood transfusion? There are several reasons why you may need a blood transfusion, such as first, a sudden loss of blood due to an accident or injury. Second, blood loss as a result of surgery. Third, a low hemoglobin level before, during, or after surgery, or hemoglobin is the protein in red blood cell that carries oxygen. Fourth, severe heart, lung, liver, or kidney disease. Fifth, bone marrow failure. Sixth, moderate to severe anemia or decreases red blood cell. And then the part of blood. Human blood is made of blood cell and a fluid called plasma. Plasma carries red and white blood cell and platelet. Each part of blood has a special function. This part can be separated from each other. Bone marrow, the soft, spongy material in the center of the bone, make most of the body blood cell. Here is a look at each part of the blood and why it might be transfused. And the first, red blood cell. This cell carry oxygen for your lung to other body organ. They also carry carbon dioxide back to the lung to be breathed out or exhaled. The body needs a certain number of these cells to work well. Bleeding due to injury, surgery, or disease may cause a low red blood cell count. This is the most common type of transfusion. And the second, white blood cell. The cell fight infection by destroying bacteria, virus, and undergarment. White blood cells are rarely transfused. They are often set aside as a short-term or temporary treatment for people with a low white cell count and severe infection that has not responded to antibiotic. And the third, platelet. This little piece of blood cell help blood clot. Your body may not make enough platelet. This might be due to bone marrow disorder, increased destruction of platelet, or medicines such as chemotherapy. Platelet might be transfused before a procedure that might cause a person with a low platelet count to bleed. And the fourth, plasma. This fluid carries the blood cell all over the body. It contains protein, vitamin, and mineral. Some of the protein also help blood to clot. Plasma or fresh frozen plasma can be transfused in people who severely lack certain part of the blood that help with clotting. What are the risks of a blood transfusion? Most hospitals use blood from volunteer donors. These donors are not paid for giving blood or blood product. Each blood donor must answer medical history questions and have a limited physical exam before being accepted as a donor. Donated blood is carefully tested, which lowers the chance of transfusion-related infection. Donated blood is tested for hepatitis virus B and C, HIV, human lymphotropic virus or HTLV 1 and 2, syphilis, West Nile virus, Chagas disease caused by a parasite. Most transfusions are done without any problem. Mild side effects can often be treated with medicine if you need more transfusion. Most side effects may include symptoms of an allergy reaction such as headache, fever, itching, and rash. And then other type of blood donation. In addition to general volunteer blood donation, there are two other type of blood donation. And the first directed blood donation and the second donating blood for yourself. And then what happened during a blood transfusion? A blood transfusion may occur as part of your hospitalization or it may be done as an outpatient. This means you go home the same day. The first blood is collected and stored in confirmed or sterile bag. And the two, before blood is given you, it is cross-measured with your own blood to make sure it's compatible. And the third, the blood will be given through a needle or thin tube or catheter placed in a vein. And the fourth, your temperature, blood pressure, and heart rate will be checked many times while the blood is being given. And the fifth, it may take a few hours to complete the process. And what happens after a blood transfusion? The first, after you have received the blood as requested by your healthcare provider, the fluid that was placed in your arm will be removed and you will be discharged. And the second, you will be able to go back to your normal activities unless your healthcare provider has made other recommendation. Okay, thank you. I will be happy to answer any question you may have now. You can comment below or contact the Instagram and email. A thank you to the audience for their attention and participation. That's all I have time for. Thank you very much for listening. Bye bye.